here today to speak with Rita Wilson about her experience having COVID-19 and a new campaign she's joined called the Race to 200 Million, which is aimed at promoting flu vaccination. Flu vaccination is going to be a big deal this year as the United States prepares for the coming flu season, even as COVID-19 cases continue to climb, a situation that experts are calling a possible flu-COVID twindemic. I'd like to say just a couple of things about Rita. She's an actress, singer, songwriter, producer, an activist, and a humanitarian. She and her husband, Tom Hanks, are arguably America's most beloved Hollywood couple. When they revealed way back in March that they were battling COVID-19, it came as a shock to a lot of people. And it really helped America become more aware of this new threat. Because if Rita Wilson and Tom Hanks can get COVID-19, anybody can get COVID-19. Rita, thank you so much for being with me here today.
Thank you. It's good to be here.
I'd like to kick off our conversation by asking you about your COVID diagnosis. When, how, where did that happen? What was that like?
Well, it was in March, and I had just finished doing a show at the Sydney Opera House. And the next day, I had taken a harbor cruise around Sydney Harbor, and it was gorgeous. And I started to feel a little chilled. And I thought, well, that's normal. I'm still getting through jet lag, and it was out in the elements all day. So just passed it off as that. The next morning, had to get up very early, do a show. And by that night, Monday night, I just started feeling really achy and started having a headache, started feeling weak. That night, I had a really bad fever and an episode of chills. And I just thought, again, I was just chilled from being on the boat all day. The next day, it really kicked in terms of fever and chills. And that's when, and so did Tom, my husband. And that's when the doctors came and they were like, we have to test you for COVID-19. And I really didn't think we had it. I thought we just had a cold at that point, but the test came back positive, and they said, we're going to have to hospitalize you because our fevers had increased. And at that point in Australia, they were trying very, very hard to contain it. We went to the hospital, was there for 3 days and 3 nights. The fever got worse, symptoms got worse. They were very concerned about fever. And after 3 nights, they said that our fevers had gone down enough for us to go home. We went back, and I had read that between days 5 and 8 is when it can really kick in and take a turn for the worse in some people. And that's exactly what happened. Everything seemed to be compounded. It wasn't just a fever. It was now a massive headache that would not go away. It was nausea, gastrointestinal issues. I experienced vertigo, and I also lost my sense of taste and smell, which back in March, people didn't really know that that was a thing. And I kept on saying to the doctor, has anybody else talked to you about this? And he said, no, but about a week later, people were talking about it and saying that they had lost that. So it was, in some weird ways, kind of textbook. It got worse day 5 through 8. It compounded with more symptoms and really incredible aches and pain and shivering and fever. I've never, ever been that sick.
Wow.
So it was not something I care to repeat ever again.
So how many days were you sick overall?
If you take the lead up, the massive and leading down, I would say about 2 weeks. And then about in week 3 is what you're really, you're trying to recover, rest, catch up on your sleep, start eating again. I lost a lot of weight. Mm-hmm. And just get your wits about you. It was really an interesting experience.
It sounds like it was really scary. Were you guys really, were you terrified, or did you feel like?
I was really scared for a moment because I really did not know if it was going to take that turn where it got into your lungs. And I was really worried about that because everything I knew about that was very scary. And there were people in the hospital when we were in the hospital that were on ventilators and oxygen and in quite serious conditions. So I did not take for granted that we wouldn't get there.
Right, right. Were there things that you did during that time that helped you endure it a little bit better? Do you have any advice or tips for people who are going through the same thing?
Yeah, I I listened to the doctors and I listened to a lot of music during that time. I really found that incredibly comforting, it and distracting, and didn't require, looking at something. I couldn't look at a screen. I couldn't watch TV. I couldn't have that kind of concentration. So you could close your eyes and you could listen to music, and that was really helpful. I even made a playlist called Quarantunes on Spotify.
When you and Tom were diagnosed, you were very public about it on social media, which I think was incredibly useful in terms of helping people understand what was happening and what this disease was. What inspired you to go on social media as you did and really share what you were going through?
Part of it was that we had done everything to avoid getting COVID-19. We were extremely cautious, conservative, following all the practices of social distancing. And at that point, masks weren't talked about as being something we should do, but washed our hands. Even on my flight down, I was sterilizing everything I came in contact with, wearing gloves, had gel, had sterile wipes, and brought my own food on the plane. I wasn't going to take any chances and still got it. And, I don't really know how we got it. We all have had those moments in life where you hear about something happening to somebody and they saying, oh my gosh, I can't believe it. But it's somebody, it's not you. And I had breast cancer 5 years ago and realized that I was the one out of 8 that women that will get breast cancer. And once you go through something like that, you realize that you can also get COVID and you can get the flu and you can get all sorts of things. So that's just life. You cannot control that. And so it was important to go out on social media because we wanted to let people know that we were doing all the right things and we still got it.
Anyone can
And it was
get it.
serious.
Anyone can get it. It's so dangerous. Let me ask you about the imminent arrival of flu season and the possibility of a flu COVID twindemic, which is both things happening at the same time. Why are health experts so concerned about this? Why is this something that you're sort of engaging with?
2 reasons. First of all, COVID isn't going anywhere and we're entering into flu season.
Mhm.
And so the nurses that took care of us were amazing. And the American Nurses Association has this incredible mission, which is the race to 200m.com is the website, or the race to 200m on Facebook. And here's why. There is a high risk group of 200 million people that are more at risk for getting the flu. And those are people over the age of 50.
Mhm.
I know I only look 49, but I'm over 50. And people who have chronic diseases like heart disease or asthma or diabetes. And so I kind of thought, you can't take a chance, really. We've seen so many people die from COVID. People die from the flu every year. Why take the chance? And I really wanted to be a part of getting that message out there that you can get a flu shot. The CDC recommends some guidelines, which are getting your flu shot in September to the end of October. That's kind of the best time to get it. But because that gives you 6 months of protection and kind of gets you through the winter. But if you didn't get it, if you didn't make that deadline, you can still get a flu shot and it can still offer protection. So I would really say, go to your doctor, your healthcare provider, and ask, when should I be getting this? And tell me everything you can about it. If this happens, this twindemic, which we don't know what that's going to look like, but there is going to be flu and there is going to be COVID-19. We cannot have our healthcare system and our nurses overwhelmed the way that they were when COVID hit. And having a flu shot is going to lessen that probability and that occurrence. And, if you have a loved one and that person can't get to the doctor because 20 other people are at the hospital trying to get in there because they have the flu, I don't know. It just feels to me like it's a smart thing to do. And also, I had the flu one Christmas, and actually, multiple members of our family had it one Christmas, and we completely missed Christmas. And one of my son's birthdays is around Christmas too, and missed that and missed out on all sorts of family gatherings and get-togethers. And to me, that's everything that I want to be doing. So I don't want to ever have to get there again.
And especially this year when people might be wondering, do I have the flu? Do I have COVID? The symptoms are so similar. There's so much overlap. I think that anxiety level is going to be really very high this.
Right. Right. And I think one of the ways to eliminate that concern is by probably getting a flu shot and going, well, if I have those symptoms and I had the flu shot, I might have COVID. There's no, I really think the best thing to do is talk to your doctor and ask her what, get all the information that you can about COVID symptoms, flu symptoms, and what those look like.
Well, thank you so much. This has been a great conversation, and I appreciate your time and your insights. Thank you so much, and good luck with the campaign.
Thank you so much.
Okay, thanks.
Bye.
For more information and tips on navigating your health and well-being during the COVID-19 pandemic, go to everydayhealth.com/Tippy.